Welcome and thanks for joining us on the Flourishing Life podcast, where we will be discussing what we see on the daily. We're Jackie and Taff from Flourish Medical and Wellness in Savage, Minnesota, where listening to our patients is the priority. Our foundational medicine clinic bridges the gap between traditional and functional medicine. We are pattern recognition specialists that focus on individualized patient care and health optimization. With a combined 30 years of medical experience, our goal is to provide insights that will help you take control of your health. Be sure to follow us on Instagram at Flourish Medical Wellness and on our website, flourishmedicalwellness.com, to stay up to date with what's happening at the clinic. The following content is the opinion of Jackie and Tewes and is not intended to diagnose or treat any medical conditions. Please be sure to speak to your healthcare provider for your unique needs. Welcome back, everyone, to the Flourishing Life podcast. We are so excited that you're joining us today. We have a special guest, Emily. She is a registered dietitian, nutritionist, and an integrative functional nutritional certified practitioner. She also has a certification in childhood obesity, which is a pretty amazing thing that we really need a lot of help with these days. And so we are so excited to have you here to chat through things. And Patrice is here to help with this podcast today. So we're going to dive right in and talk through kind of her business and then her specialty and where she comes from. So her business is Anywhere Nutrition.
Yep.
And so please just tell us a little bit about you, your background, and kind of how you came to be with this business and where that all started and how it came.
Yeah. So I started out just totally conventional dietetics, nutrition pathway. My first job was at the Regents Hospital, which is a conventional, obviously, space. And I started on the intensive care unit for cardiac patients. So I would see people who had cardiac arrest or had a heart attack. And it was very eye-opening. There was nothing to do with prevention there. This was all keeping these people alive. So I did a lot of tube feeding management, and what I was not expecting was to work with a lot of people literally trying to beg them to eat. As soon as they made it through their event and they were extubated, is they had no appetite. It was related to the chronic pain that they were in, the medications that they were on that were completely ruining their appetite, but they could not recover from their illness in this episode if they weren't getting any nutrition in. And so it's that I didn't expect the beginning of my career to be, just trying to come up with creative ways to get people to eat in a hospital, which involved, this, really horrible sugary beverages. And we've all seen the commercials for Ensure and Boost and all of those awful things. But they have their fingers in every part of healthcare. But I knew I couldn't do that for very long. I loved the people that I worked with, but I knew that my heart when it came to nutrition was in education and prevention. So I had now seen this awful side of heart disease. I also worked on the renal floor with kidney failure patients, and a lot of that is related to lifestyle, like uncontrolled diabetes, uncontrolled blood pressure. And I so badly wanted to help these people and get them out of this cycle, but they just, as soon as they were in this cycle of chronic illness, it almost was like a revolving door for a lot of these people, side effects from the medications they were on. So about a decade ago, it was 2015, I learned about the Food is Medicine conference. It was coming through Minneapolis, and I was put on by the Center for Mind Body Medicine. This Mark Hyman was there. It was before he was a really big deal. Dr. Aviva Romm was there. Jim Gordon was there. And it was the first time, so sad, because obviously a dietitian, food should be my first thought for everything. But this was the first time I had learned about the power of food as medicine infiltrated into every health condition I could possibly think of. Dietitians there were reversing acid reflux and getting people off of medications without even, really having to consult a physician. I mean, obviously we worked together to let them know that they didn't need their medications anymore, but reversing these illnesses that we normally would refer on to a provider, helping people with constipation that they had had their whole lives, or debilitating diarrhea, IBS symptoms, really getting to the root cause of it with food and correcting digestion. It was this whole new world that just deepened my love for the field, because in conventional dietetics, some people ask like, well, really, what's the difference then with working with a patient with diabetes in the conventional world versus like functional world? Conventional, we were taught to teach people how to carbohydrate count. So this is basically, they had medication that would cover them to eat so many carbs per meal. And in the hospital, it would be up to like 75 grams of carbohydrate for a sedentary. So someone who was not active at all, which is a ton of carbohydrates. We're talking like 5 to 6 slices of bread at a meal, like the equivalent of that. So it was really like teaching people how to manage and just like live with it. Like you have diabetes now, and this is how you manage it and keep your blood sugars in a better range. Whereas like the food is medicine approach was, why does this person have diabetes? Like, is it because of chronic stress? Is it because of sleep? Is their diet actually pretty decent, but they're not active at all? And it's figuring out why that specific individual is having high blood sugar issues, and not just treating every single patient with type 2 diabetes as the same, because the way that, this person might get there is different than this person that might get there. And I just found that so empowering, and patients absolutely loved it. They're like, someone's actually asking me about my story and customizing this experience. And I just fell in love with functional medicine. So I left my ICU position, transitioned into a functional medicine clinic. It was so challenging, but so fun, because a lot of these people have, they've made their way through the medical system. They've gotten referred from their primary care doctor to rheumatology, endocrinology, and they're just like, there's nothing other than meds that I can do for my joint pain or my Hashimoto's fatigue. And, they're told, no, there's no research out there that lifestyle makes a difference. And the people who are just like, I don't believe that, which are my favorite, right? They find functional medicine, and then you're like, yeah, we can play around with food and your lifestyle. And then we do. And like 30 days later, even for some of these people, they're just a completely different person. And they're like, I will, I will follow anything that you recommend, because this is exactly what I've been looking for. And that's really where Anywhere Nutrition came from. Is I was getting these patients that were autoimmune or had digestive issues. And, the gold standard was an elimination diet. So I was taking them through eliminating gluten and dairy, sometimes a few more things, maybe corn, really cutting down on added sugars where we could, and ultra processed foods, and just trying for a month to be like, eat really low inflammation foods, very nourishing foods, but cutting out those big triggers that we know for autoimmune conditions. There's great research on gluten-free diets for autoimmune conditions. Well, I feel like they don't know this. And 30 days later, they would come back and they'd just be like, my fatigue, is gone, and I feel more clarity, and I'm sleeping through the night. Insomnia is a big one that's connected with gluten intolerance. And then they'd be like, now what? Like, now what do I do? Give me some recipes. And then I'd give them some recipes, because, I'm a big foodie. So I would just pass on some of my favorites. And then, 30 days later, they come back and they're like, those are great, but like, we need some new ideas now. My kids are tired of that for breakfast. Let's send them some new ones. And then I was like, why isn't there a place where I can send these people like a good blog or something? There's tons of gluten and dairy-free blogs out there, but they're not macronutrient balanced, meaning they don't have a good balance of protein and fat and carbohydrates that are going to keep people full all day long or be really good for blood sugar. They're delicious foods. Usually they're really pasta heavy, or maybe meat heavy, or maybe they don't have any protein at all. So it's just they're just not going to satisfy their nutrient needs. So I was like, I'm going to create it. I love to meal plan myself. I do it every single week. It's like how I survived working 5 days a week outside of my house and commuting. And it's like, I'm going to take the menus that I create myself, and I'm going to publish them online, and people can subscribe to them. So that's what I did. And that's what Anywhere Nutrition is. It's gluten and dairy-free meal plans, and really just trying to get people off of that ultra processed foods lifestyle and help them stick to that gluten and dairy-free lifestyle that really helps with their symptoms, and in a way that's also where their whole family can eat it, and their picky husband can eat it. I hear about that all the time. I have this wonderful member who's been with me for like 3 years now. She was cooking a gluten-free meal for herself, a meal for her kids, and then her husband was like kind of like a meat and potatoes guy. She was cooking something different for him every single night. And it was like, how did you do that? And so she subscribed to the menus and she's like, I am cooking that one meal for everyone. And it's satisfying the meat and potatoes guy. It's satisfying the kiddos. And she's not having to multitask for all of these different needs. Yeah. But you'd be so surprised at how many people are doing that, where they're cooking separate meals for themselves so they can be gluten-free. And then they're cooking something different for their family. And that's what I really like, simplifying it for people who have to be gluten-free, because they tend to quickly go to these swaps of, they go to the grocery store, they go to the gluten-free aisle, and they're like, oh my gosh, this stuff is super expensive. The bread's this big. How am I supposed to feed my family all this expensive food? And it's like, you don't need all those ultra processed substitutes in order to, eat, gluten and dairy free. Like chili is naturally gluten-free. I bet you love chili, like homemade cornbread, naturally gluten-free. That satisfies the meat and potatoes guy, that gets you, and your kids can also eat that. So it's simple recipes like that work for everyone. I love it.
That's awesome. I think everyone we know probably in the clinic could use that. All of our patients.
Yes, that is for sure.
So what are some common pitfalls that you see with clients, either, from your past work or even with your current work? What would you say is the most common thing that people struggle with?
I think it's creating the habit around being prepared for your week. I'm sure everyone can relate to, it's 5:30, it's 6:00, and I don't know what I'm going to make for dinner. And whether it's just you by yourself or you and your spouse or you and, all your kids, if you don't know what you're going to make, it is so frustrating. It leads to a lot of arguments with your partner. And then we end up either ordering in food that's super expensive, eating out, same thing. It is so expensive. I'm sharing a random side story, but I was just back in my hometown this last weekend, and they literally have there's no restaurants. So Subway is very popular. And someone was sharing that they got 4 sandwiches for their family, and it was $50.
Oh my God.
To eat at Subway. $50. It's just like...
It's ridiculous.
Unbelievable. I mean, and that's really...
Wow.
Yeah. So it's you can't even really, eat out on...
That used to be like, what, 10 or 15?
$5 foot long. Yeah, for sure. Absolutely.
It's been a while since I've been there.
Oh yeah. That was like my high school. It was all we had in our small town. But it's just, even those last minute, we'll just eat out type of things. It's too expensive, and you're obviously not getting any nutrition from it. So, and we're trying to stay away from those foods in order to lower inflammation in our bodies. Right. So I would say that not planning ahead is huge. So it's the first step inside my membership. Like I have this welcome to the membership. Before you dive in and do anything, I'm going to teach you how to create a habit of a plan, and you're going to get out your phone and we're going to schedule this. Because if you're going to, it's just like if I were to send you a Peloton, right? I send you a Peloton bike and you're like, great, this will mean I'm going to exercise and finally hit my fitness goals. But if you don't have a time of day when you're going to use it, you have no idea how long you're going to use it for, which program you're going to do, it's probably just going to sit there. Even though you have the greatest intentions, it didn't even cost you anything. You got it for free. But if you don't have a plan around using it and when you're going to use it, it's going to keep getting pushed off. There's plenty of people, I'm sure, that could relate to having a piece of equipment in their house for exercise that they don't use because, again, or a gym membership because they don't have any plan to use, work it into their day. So I think it's so important to schedule it and kind of have a game plan. And I always tell people that are starting out, I have some people join the membership who are already avid meal planners, and they're like, I just need new ideas. And they already kind of have their own cycle they're going to insert it into. But I would say most people, this is a very new, being prepared for their week is a new thing. So I'm like, you pick out your one new recipe, utilize whatever you were doing before, whether it's you have a taco night and a Italian night or something, and then you pick one new recipe to insert into your week, which I know doesn't sound like much, but after 52 weeks, that's 52 new recipes in a year, which is so many. So one new recipe, and then you're going to pick which day you're going to grocery shop. And we're going to plan ahead so that we would try to pick it, if your week starts, as a Monday through Friday, like a typical week, then maybe we're grocery shopping on a Friday, Saturday, or Sunday. And then we're ordering our groceries online to be delivered on Sunday, which is the best, right? I love grocery shopping too much to like allow someone to do it for me.
yeah,
But
absolutely.
most people don't, especially if you have kids, like to not have to go in the store. I mean, you're going to save so much money ordering it online. So, yeah, scheduling when you're going to have your groceries delivered or when are you going to go grocery shopping? And then you have those things on hand. So now when you come home from work on Monday night, you're like, I have everything on hand to throw together that chili recipe. This is awesome. I don't even have to think about it. I just have to pull up the recipe that's on my phone and make it. And I'm going to make extra. I love, I almost always double the recipes like that in the membership so that people intentionally are buying extra so that they either can freeze it or they're going to bring it for lunch for a few days, or they don't have to cook dinner the next night. They can have chili again. Like, I mean, recipes like that get better the longer they sit. You know,
sure.
chili's not even that good the first night. It's better the second night when the spice is really like set into the meats and the vegetables in there. So I'd say that's probably the biggest pitfall is just not planning ahead. Have either of you read Atomic Habits?
No.
Okay. This is the best book. I read it year after year because I think it's such a great reminder. I think it's Johann Hari, if I'm thinking of the right author. But Atomic Habits, if you Google it, he created a whole app around it as well. It's one of the best-selling books for the last 10 years. But it teaches habit creation. So if there's anything in your life that you want to change, whether it's flossing, like who doesn't need to remember how to floss, right? But if you put your floss in your medicine cabinet or in your closet or whatever, and you don't come up with a plan of when you're going to floss, guess what? You're not going to floss till you get to your next dentist appointment. But if you make it obvious, like you leave it on your nightstand or you leave it by your toothbrush or you put it by your coffee or something. So while your coffee's brewing, you floss your teeth, you habit pair and you make it obvious, or you create some sort of a tally there. You like actually keep track of it. He has got these great tips for creating habits and really starting out slow, that you're not doing like, I'm going to floss. I'm going to keep up my hydration. I'm going to walk 10,000 steps a day. It's not doing all these things at the same time, but picking one, creating a lifestyle habit around it, and then conquering the next one. So highly recommend Atomic Habits to anyone listening. It's such an easy read. And again, you'll read it year after year. It's such a great reminder in a new year.
That'd be great for our patients who are like, I can never remember to take my supplements.
Or
just don't hide them behind a cabinet door. If you leave them in the middle of your kitchen table, right?
Well, I don't like things on my counter, is what I hear.
You have to get over that. Or else you'll never use it. You can put it away when people come over, but bring it back out.
Yep, totally.
I think this circles back to like New Year's resolutions as well. And with weight loss clients in general, how so many I hear, well, they don't want to meal prep, or they'll tell me they will work out, but then they never schedule it in. Mm-hmm. And it's just so important to schedule in those workouts, to schedule in your meal prep time, to be prepared for the week. Because if you're not prepared, you're just really going to struggle. So do you have some tips for people who want to reach a New Year's resolution, not even just with weight loss, just with better health in general?
Yeah. One of my favorite recommendations for New Year's resolutions is to pick a skill to learn, which I don't know, it maybe isn't as exciting as like picking a new diet to do or some sort of weight loss plan to sign up for, which everyone will be doing January 1st. But think of a skill that you could learn, that you could continue to work on as the year goes on, that will serve you forever. Like think of something that used to intimidate you so much. My one example is one of my New Year's resolutions one year was I really wanted to learn how to make a whole chicken, which sounds so silly and I don't know, not sexy enough for a New Year's resolution. But I was like, it's something I've always wanted to learn. I've always wanted to learn how to make my own bone broth. If you've ever purchased good quality bone broth, you're like, why is this water so expensive? It's And then once you make your own chicken, it's basically free because you're just utilizing these bones all over again. Your house smells amazing. It's like the best diffuser you can have is a homemade bone broth, like wafting through your house. Because I make mine on my slow cooker and then it just sits overnight. But that was one of my New Year's resolutions. And now I can make a whole chicken without ever thinking about it. And I make homemade bone broth and it's just a part of my routine. But once upon a time, it was super intimidating to me on my start of my like real food journey. So, and I've just also learned a lot about food, like utilizing a whole chicken and all the pieces that come with it versus what we know. when you go to the grocery store and you're just continually buying chicken breast, like where are all those other pieces of the chicken going? It's not a very sustainable approach, the way that we eat food in the US. So it was also really cool and rewarding to connect with local farmers, buy a whole chicken and learn that process and get really more connected with food. And it's just not as much work as it seemed like I thought it would be. So it could be any skill. So it could be taking, in the Twin Cities especially, we have so many cool places to take cooking classes. You could take a class on how to make pasta or a sourdough one. The sourdough is so popular now, and I think that's such a great way to reduce your reliance on something that used to be, three simple ingredients. We got your flour, your water, and salt, 3 ingredients. If you look at the ingredient list on any bread in the store, even if it's labeled as sourdough, it's at least a dozen, if not 2 dozen. And it's just because we've just processed everything to the max. And it's just mind blowing how many different loaves of bread there are in the grocery store to navigate.
Yeah.
So if you can learn how to make sourdough at home, create that routine, you've reduced your reliance on one major piece of ultra processed food. You'll also probably consume maybe a little bit less of it because you really have this greater appreciation for all the love that went into it. And it takes a little bit more time, but it's just, you create more of a appreciation for your food, I think, when you get more connected to it that way. So I think if there's something skill-wise that you can learn, it could even be, strength training, weightlifting, could be a meditation class. You've really wanted to learn how to meditate, so I think learning some of those skills, those are wonderful New Year's resolutions that will serve you forever. Don't sign up for all of them. Just pick one and start there.
You know what I just thought about? It would be amazing to have grocery stores actually organize their food by number of ingredients on the labels.
That would be so scary.
Wouldn't that be amazing?
I mean, I just always tell people, stay on the parameter. Don't go in the middle.
Yes.
And you'll be good.
Yes.
Yeah.
Which is, that pretty much is where the single ingredient things are. Your whole meats and your fruits and vegetables.
Yeah.
Yeah.
So I understand in the last couple of years, you were on quite a health journey dealing with endometriosis, having surgery to remove that, and then some post-op complications that came up. Can you tell us a little bit about what diet protocol you did to help heal your endometriosis? And then also, what is an autoimmune diet protocol look like? And how can we simplify it for people? We have a lot of patients here who have autoimmune disease, and we try to give them a starting point, but it can be really overwhelming for them.
Yes, very overwhelming. So I guess a brief background of my endometriosis story. So when I got my period at 15, it was immediately awful. Lucky me. My mom had horrible periods. My sisters both had awful periods. Somehow I was, I think, struck with it the worst. I think both my sisters, when they had kids, that's been shown to, reduce the pain with periods moving forward after you've had a child. So mine just really stuck with me. So, I didn't really get any answers. And I think back now too to high school, and every single year I would have like a sports physical for cross country, and then no one asked, there was no, what are your periods like? It was just, do you have one? Check. When was your first day of your last period? That was all they really wanted to know, but nothing, no deeper dive. And there was really no discussion about endometriosis. I don't know if I even heard the word endometriosis until I got to college. And now I don't know if the algorithm is just targeting me, but on social media, all I hear is endometriosis. So I'm glad it's finally getting some attention, because infertility is obviously on the rise, and it's one of those big root causes of infertility. But I kind of navigated it on my own by putting Band-Aids on it. So first it was ibuprofen. That's all I used in high school. It was just awful. It really didn't even move the needle. And as soon as I got to college, I was like, free birth control. I grew up in a small town, so we didn't have any resources like that. So I got to the cities and I was like, I can go to a clinic and they'll give me free birth control. And I read in a magazine somewhere, some teen magazine, that could help with period pain. Sign me up. And I don't think you could have convinced me to do anything different, because it was so debilitating once one day a month. It could, and it's a, who knows when it's going to happen, even though I had regular periods, every 28 to 30-ish days. I didn't know exactly when it was going to land, but I knew that entire day was shot now, and I could have been at cross country practice or in the middle of a test or hanging out with friends at dinner. And so when I got this golden ticket, which I thought would be birth control to get rid of all of my pain, I signed up for it. And I did get this great relief. My period pain went away. But a couple years later, I lost my gallbladder to gallbladder disease. I had giant gallstones. The surgeon was like, what in the world? Like, you're a college athlete, you're fit, you're healthy. This is so abnormal. We have no idea why you have gallbladder disease. And I didn't learn until many years later, just Googling. I was like, maybe it was, birth control. And it's just like lawsuits after lawsuits about the connection between birth control and gallbladder disease. And I was like, I gotta get off of this pill. But I was obviously really scared to go back to painful periods. It's just still no one really had any answers. And I think by that time I'd read that, surgery was it. And so I never wanted to have surgery for my endometriosis. It just felt like way too extreme. So I did come off the pill and I started, tracking my cycles naturally, and they weren't horrible. And it got a little bit worse as the years I got further away from the pill, and which I've learned that it just takes a long time to detox from synthetic birth control. They started, to get a little bit worse and a little bit worse. So I've tried so many different holistic avenues. It's one of the ways that I really got into holistic health, too, in addition to the conference that I attended and playing around with Chinese medicine and herbs and all those beautiful things and supporting my body, but none of it worked. And what I thought and what I was told at the time was that birth control was stopping endometriosis from growing, which we now know it doesn't. You don't have symptoms, but it's still growing the entire time, which is just so sad. We were so misled. And I still feel like that's something that's really commonly recommended, and people don't realize that it's not fixing anything. So I unfortunately in 2023, my appendix ruptured out of nowhere, and I didn't go into the hospital or the emergency room until I was like septic, because I thought this was just period pain. I'd been so used to such a high level of pelvic pain that I was like, this is either like terrible gas. I sent my husband out to go get like over the counter, like Gas X, which I didn't have in the house because we didn't really use stuff like that. And then I took like the max dose and it didn't move the needle. And I was like, I think I have a fever. It was in the middle of winter, so I was used to being like cold and hot, moving indoors, outdoors. Anyway, so silly. I don't know. It just goes to show how ridiculous endometriosis pain is. But I went to the ER and they were like, your appendix has blown, like it's already ruptured and you're septic and we're admitting you to the hospital. And I was like, oh my gosh. Like, even when I was getting my CT scan in the emergency room, I was like, maybe I'm just ovulating. Like maybe this is just ovulation pain. And I mean, just ridiculous pain. And we just, I don't know, women, right? It's got to be something else. It can't be the worst case scenario. So unfortunately that happened, and they just treated with antibiotics. So they didn't actually go in, remove anything, because it was just too much inflammation. So they actually just let whatever exploded re-heal how it would. And they recommended surgery like a few months later, but I felt pretty good. So I was like, well, I'm not going to have an elective surgery if it seems like things have healed and your appendix could regain actually its function. I was like, cool. I'm not going to have surgery. But then about 9 months later, I started getting a lot of pain on my right side. So now I was having pain with my periods and I was having pain during ovulation. So I was like, all month long, I was getting just annihilated by pain. So I was like, okay, if I'm going to have my appendix removed, I might as well also, if someone's going in there, like let's look and diagnose this endometriosis if it's what I think it is all these years. So I consulted with a couple different surgeons. Some of them scared me to death. One, that's highly recommended in the state of Minnesota, at a very popular hospital. I just remember her saying like, if I go in there and remove the endometriosis, do you want me to keep all your other organs? And it was like, I am not having you operate on me if that's even like what your first thought is of, are we going to remove your ovaries? Are we going to remove your tubes? Are we going to, I was like, no, I need someone who has a different approach than this. You're scaring me. And she also just really didn't know anything about estrogen and its relation to endometriosis, which is just seems like 101 endometriosis. So I was like, if you're a specialist, it scared me. And so then I found the surgeon that I ended up going with after leaving her behind. And she was absolutely wonderful. She totally understood endometriosis and was all about restoring natural fertility and keeping all of your organs. And so I had a dual surgery. I had a general surgeon there that removed my appendix, which I learned adhered to my abdominal wall. So it was like gum stuck on a concrete sidewalk kind of a thing. So we couldn't salvage that, unfortunately. And then I had she removed my endometriosis after he had removed my appendix, and it was everywhere. It was a very heavy diagnosis. I mean, I assumed I had it all of these years, right, with the symptoms, but I just never realized it would be like on my bladder, on my ovaries, on my rectum, on my small intestine. And I mean, it was 5 different organs were impacted. It was really heavy. And but it was successful. She was successful in removing it all. I was going to look back up to see how many biopsies she removed. I think it was like 30 or something, different spots. And my fallopian tubes were completely clogged. My body had actually created something which I had no idea even existed, but accessory fallopian tubes. So my body had created a separate set of fallopian tubes that were non-functional, but it tried to create a new pathway. Because the other ones were so clogged up with endometriosis.
Yeah. I mean, we know about accessory like blood vessels in the heart when there's blockage so that your heart will make, I did not know that could happen with fallopian tubes.
Yes, on both sides. So she removed both of those, and then she specialized in cleaning out the fallopian tubes. And then she also does a bacterial swab of inside the uterus, if I'm thinking correctly. Yeah. And to see if there's any bacteria there that aren't supposed to be there that are also linked to infertility. I had not been pursuing pregnancy, so it wasn't really something that I was seeking answers to. But when I see now, I mean, it's just infertility is just, it's so sad watching my friends, navigate this and knowing that how many things could be working against them with the fallopian tubes and the bacteria that's linked to miscarriages that's there that conventional doctors just are not looking for. And endometriosis as well. So
I think it's really interesting too, not to interrupt.
Yeah.
So I had a fertility journey of my own, and it's really interesting how many doctors don't pursue looking to see if you have endometriosis to see if that's your cause of infertility. And luckily I was seeing a more holistic OB, and she suggested that we do that surgery. So I've had that lap surgery like you have.
Yeah.
Obviously yours probably was a lot more painful and extensive than mine, but it's just crazy how many women tell me, I have unexplained infertility, but they haven't done a lap surgery to see
I know
if there's endometriosis.
It's so sad that it has to be that extreme too. I mean, I've had CT scans, MRIs, ultrasounds. I had a ton of CT scans, unfortunately, when my appendix ruptured, and like there was no one said anything about endometriosis. And so it's just that there are specialists out there that I'm now learning that you can have an ultrasound done by that know how to look for endometriosis, and MRIs as well are now, there's certain specialist radiologists that know how to look for it. So it's just like, if over the years, if I had just gotten the right person, I don't know. I don't think I would have pursued surgery. I know I wouldn't have if my appendix hadn't ruptured. It just wasn't. Surgery is so scary, right? And obviously I had the worst case scenario afterwards where I developed an abdominal infection. So I had likely from where my appendix was probably harboring antibiotic resistant E. coli. So it got into my abdomen in like 5 days after I had gone home from the hospital. I started developing really bad fevers and ended up back in the emergency room, and they were like, maybe it's COVID, maybe it's the flu, you're susceptible. And that came back negative, and I went home and then on antibiotics, but nothing was improving. I went back to the ER, and then I was admitted back to the hospital. And we had all along planned on having a second surgery because my surgeon uses a adhesion prevention barrier, and she removes it after 10 days, which sounds extreme, but anything you can do to prevent adhesions is what you really want to do. So that we had planned on doing a second surgery, but this was going to be sooner than had planned. But she admitted me to the hospital, and then I was there for 7 days. It was awful. I mean, I had wonderful care other than the emergency room. Emergency rooms are just awful. But as soon as I was in the hospital, I was treated with, it was just amazing care. I had awesome doctors. My OB was wonderful. She was there every single day. But it was just, I don't know. Yeah, it felt like worst case scenario. And why? I'd given up alcohol a year before surgery. I was eating, my normal anti-inflammatory diet, but the 30 days before I did no added sugars. I was just doing everything I could do to prepare for surgery. And one thing, you mentioned like anti-inflammatory for endo. I was just eating that way because I knew that's how I should be eating, right? So it just happened to overlap with endo. But when I had my exploratory surgery in May, so my second surgery was in October, she went in to see if there was endo to remove, and because it was so extensive, she's like, I can't even do it today. We're going to do it at a later date. But she told me, there's like no inflammation in your belly. And she's like, this is so abnormal. I always see inflammation. I always see extensive adhesions. Everything is always just red and inflamed. And she's like, I can tell that even though every month, like your endo lesions are, I don't know if she said the word bleeding, but inflamed. She's like, I can tell your body is trying to fix them in between every single cycle. Like there's layers of healing that I don't see in other people. And she's like, I've only had like 2 or 3 other patients who are really, they eat grass-fed meat and they live a very anti-inflammatory lifestyle. She's like, I've only seen this a handful of times, and I can always tell it's related to the way that these people are eating, like, because I don't have to educate them on food. So I was like, wow, that's really
amazing,
reassuring. Yeah. So I figured, my second surgery, I was like, I'm going to rock this. And then, what happened. And I just had to let it go because I couldn't do anything about it. It was no one caused it. It just happened to be there, and it was an opportunistic bacteria. But yeah, so just getting back on eating those same foods afterwards. Like I made my husband go to the grocery store, and once I ran out of my own homemade bone broth, we were getting it from the co-op that made it from scratch, and it's just that big bottle of jiggly jello-y bone broth. So we focused on, I drank a lot of that, focusing on a lot of proteins. Like the co-op also made this really lovely like meatloaf, which kind of sounds silly, but like getting an iron and grass-fed meats was like top priority after surgery because protein is the building block of new healthy tissue. Mm-hmm. It was something I taught all the time in the hospital. Is like, you need to get in protein or else, your wounds are not going to heal correctly or heal well. So we were focusing on that. I was doing a lot of fresh juices, like just, fresh squeezed oranges and things like that. And just getting back to eating the way that I was eating before. I tried to batch cook meals and had them in the freezer. So I had a lot of soups that I could just, take out of the freezer and heat up and eat. So just really getting back to that lifestyle as quickly as I could. I'm really into herbs as well. So I'm getting trained in herbalism. And so I was incorporating teas wherever I could, like turmeric and, curries, things like that, in order to get in more anti-inflammatory herbs to help to heal.
Will you, kind of what Patrice said, kind of talk through autoimmune diet?
Yes.
How to simplify that? Because we get that a lot every week.
Yes. So the AIP diet is really extensive. I don't think I ever really utilized the full AIP with clients. It was just, again, it was very overwhelming. So every single time I saw someone, I would meet them where they were at. So if it was, can you just go gluten-free for the next 30 days? Can you do that one piece of the puzzle? That's where I saw the biggest turnaround in symptoms. So it's like, if that's the one thing we can do, great. But if we would get people, or I've seen people where they've already tried gluten-free and that alone helped, but it wasn't everything. So then we would do the additional dairy, we would do corn, sometimes soy if they seemed that they would be sensitive to soy. definitely cutting down on added sugars. So we were really talking about label reading and looking at, salad dressings and condiments, of course. Sugar is added in everything, even dried fruit that has this beautiful packaging, and, it's freeze-dried strawberries, and then they sneak in a bunch of sugar. So teaching them about label reading and looking at the sugars, and then looking at the quality of meats. That's a huge opportunity that not a lot of people look at. And like you kind of mentioned before, in the heart healthy diet, it's like they think they need to cut out meats. But when we study looking at specifically switching from conventional meats to grass-fed, pasture-raised meats, we don't see the same outcomes. So looking at quality versus just eliminating an entire, food group is a really important swap. I'll never forget this patient that I saw. It was a gentleman, and his inflammation markers were off the charts. His testosterone was, I think it was like 200, 150, 200, and he was in his mid 30s, and he was I need to fix this. But he really didn't like fruits or vegetables. It was it relied on a lot of ultra processed foods, ate out a lot, drank a lot of pop. And we did basically AIP, or like kind of like the whole 30 for a month. And his testosterone jumped up 500 points
that's crazy.
in 1 month. And his physician was his PA that he saw, who did our testosterone prescribing in our clinic at the time. He was down the hall, and I was like, come here. I was like, am I reading what I'm like? Is this correct? Am I comparing the right testosterone? Because, there's different ways to look at testosterone. And he's like, what? He's like, that is unbelievable. Amazing. I've never seen that before. And obviously he was really excited about it. He was back in the gym, and he actually felt like he had energy to like do the workouts he really wanted to do to get back into the best shape of his life. And he's like, I don't love eating all these fruits and vegetables, but wow, it's working. Yeah. And he didn't cut out meat. He had gout. That was another thing. He had gout, and he had been told like he needed to cut out meat. Yeah. His gout completely went away in 30 days by cutting out the added sugars. Added sugars is a huge contributor to gout. Meat did nothing for him, issue-wise for his gout. His uric acid went back to normal. It was one of my favorite cases. I presented it at a conference. It was like 7 years ago now. Just obviously he was like from really extreme ultra processed foods to like complete whole foods. And we had to find like a middle ground for him because, again, it was very, very new. And I didn't want him to eventually just burn out from all the effort it took to be way over here. So we tried to, find a middle ground, even utilizing some prepared meals. Like there's some really great places here in Minnesota that make good quality macronutrient balanced meals, and incorporating some of those good quality shortcuts in there. Oh gosh, I just love that case because it's just such a tribute to what the power of food as medicine is. I mean, he skipped going on drugs that could have possibly have had different side effects. Testosterone wasn't the only thing they were going to put him on, but it was just amazing. And so same thing goes for the autoimmune. So either people preventing themselves from going on synthetic medications or getting off of them, or even just being on a lower dose. People feel really accomplished. And I have nothing against medications. They have their place. I have family members on medications. They absolutely have their place. But for people who want to reduce their reliance on them, or at least say, I tried all these other things, they worked or they didn't work. Okay, now I'll try it. But at least they know that they gave it a shot to try to avoid synthetic medications for Hashimoto's, their joint pain, and so on, because we know a lot of those have side effects and they cost a lot of money. It's a big industry.
Oh yeah. So you would say, kind of for those people, maybe taking it slow.
Yes.
Like picking a couple things to start with and really being good at that. Sugar probably being a top priority.
Absolutely.
Gluten being a top priority. Yes. Any other like top ones that you find the most effective or the most impactful?
I would say dairy is a big one, especially if there's digestive symptoms in there. We have a lot of lactose intolerance people in the Midwest, so at least just to rule it out. And then if we can get dairy back in, great. I mean, there's a lot of high protein, great sources that are, in the dairy category. So we don't have to eliminate it for no reason. But if it is something that causes symptoms to flare, I would say corn is also another one in there. where I've seen a lot of digestive symptoms, joint pain symptoms improve by cutting out corn. So
would you say, I get this question a lot, you probably do too. So when I say cut out dairy, they're like, well, all dairy?
Mm-hmm. I would for the 30 days, I would. And then we can figure out at the end, is it the lactose, the sugars in dairy that you're intolerant to? Is it the whey? Is it the protein, or is it casein, So we could maybe figure out which one specifically, that maybe we could use ghee instead of butter because it's got the lactose removed from it, if you can tolerate the whey and the casein.
Sure.
And, yeah.
Do you put sugar over gluten to cut out?
I think it depends on the person. So if
Okay.
someone's already eating like fairly clean, I'm going to use the word clean, but they're eating a lot of whole foods already, but
They still have gluten.
yeah, then that's probably what I would target first. And then just think about where are the added sugars coming in. I think a lot of people assume they're not doing a lot of added sugars if they don't drink pop.
Sure.
Like they're like, well, I don't do pop and I don't
Or
do
eat
sugary
candy.
coffee or candy, but it's just added to so many
Mhm.
convenience things.
Yeah.
So when people can read labels and find it, it's in my peanut butter. I didn't realize that it was in my peanut butter. And make those little swaps. We can cut out teaspoons here and there, and it really adds up. So so I'd say educating people on the label reading for looking for added sugars while staying gluten-free is a big one.
Okay.
Yeah.
Let's talk about food and toxins in our food.
Ooh.
What is your opinion on that, on toxins in our food? What do you see? Or what's your experience there?
Yeah. So I think I just actually created a presentation on this for the Academy of Nutrition and Dietetics, which is like my governing agency. It was all about environmental toxins, and whether it's in our houses or in where we work, our workplace, toxins, cleaning materials, so on. And there was a section on food additives. So there's trying to think of I don't even know where to start when it comes to food additives. I think it's important for people to know that like the US and Europe gets compared a lot when it comes to, Europe's foods are much cleaner, or they get labeled that way. I've been to Europe. I mean, you can look at the ingredient list. They label them as E numbers. So it'll say like E16, and then you can look up what E16 is and what, if it's a food coloring or if it's a preservative or so on. We've traveled with a lot of people from Europe on group trips, and they'll like flip something over and they'll be like, oof, there's like 8 E numbers on here. Like they'll know whether or not something is probably really ultra processed by it, how many E numbers they see on there. But I think one of the biggest differences between the US and Europe is Europe has we're going to test it and make sure it's safe before it goes into our food system approach. And then it's allowed, whereas the US has what's called GRAS, GRAS, which is generally recognized as safe. And they say it's okay to add it to the food system. And once we have had people have adverse reactions to it, we'll take a deeper look at it and maybe remove it from GRAS. So trans fats were generally recognized as safe for one period of going fat free. They were a big part of the fat free movement, and then we were like, they are releasing free radicals in the body that are almost acting like a cancer promoter, an inflammation promoter. We should probably get these out. So they removed them after the fact, after everyone went fat free in the 90s and 2000s, and were just like spraying fat free butter on everything.
Oh, yeah.
So bad. So they removed it. So I hate that approach with the food system. I mean, there's 10,000 different things that are approved to be added to our food products in the United States. 10,000. Like, how do we even narrow things down when we see the level of chronic disease in this country and allergies that people have and digestive symptoms and just unexplained infertility? Like how do you even narrow it down when there's 10,000 things to choose from? I think is the scary thing. And the pursuit of finding a alternative to everything. So we started with the fat-free movement, and then we've gone heavily against sugar, right? So then we're finding all these sugar-free substitutes, and everything has this artificial something added to it now. And of course, that's just how the industry works. Like right now it's protein, and I am like such an advocate for more protein, especially for women. I don't think I ever had someone in my functional medicine office back in the day that I would do a food recall from that was consuming adequate protein. So I'm so glad it's getting the attention that it's getting, but it's getting attention in like high protein foam in your Starbucks drink. And gosh, I heard a radio ad when I was home a couple of days ago for high protein Cheerios. So it's the way that we pursue these health avenues in this country that just drive me bonkers, because it's going to probably cost you $1 more to buy high protein Cheerios than your other one, but you think you've marketed to people that this is a better option. So and then you flip over the ingredients and like, what are we adding to even get this? We're adding cheap protein sources in order to add, make Cheerios look better. So yeah, again, there's so many ways to go with the additives in food. So I just really like to think about how can we focus mostly on whole foods? How can we think about buying our meats whole, focusing on whole fruits and vegetables? Again, I don't care if it's canned or frozen or fresh. I prefer frozen over canned because of, the BPA lining that we have in cans and the issues that can cause with infertility as well, or just having BPA in the body is an endocrine disruptor. So it's impacting our hormones. We have early puberty happening now with girls starting their periods at 8. Yeah. 8. It's second grade. Yeah. I don't even know how you navigate that. So we really do need to think about what's in our food and what's in our household, but we don't want to go into it and now just become totally afraid of everything. I think that's what's really important is with social media, there's more information than ever out there that's free and accessible. But I think a lot of it is scaring people because it's not meeting them where they're at, which is why I think it's so important that people find a practitioner to work with and they can help meet them where they're at with what's already clean out of their household, where are they starting, and then make steps from there versus, again, being on social media. And now, what was the latest thing that was actually healthy? And then maybe some glass water or something like that. Now it has like PFAS in it, or it's just, it's not meeting people where they're at. And I think it's scaring people and paralyzing them. And then talking about it is getting a bad reputation. Yeah. So
it's interesting to hear kind of your preference on, fresh versus frozen versus canned.
Yes.
I think I always just tell people fresh, but it's so hard in the winter. It's so hard when it's not seasonal.
Yes.
Like it's difficult.
Yes.
To do that. So
when I think about too, especially if you're like really new to cooking at home, if you go out and buy all these fresh fruits and vegetables, but then lose your motivation midweek to use them up, then you're throwing away all this beautiful food. And then it could become an argument with you and your spouse about how you're buying all this food, but we're not utilizing it, or you just feel guilty that it's going to waste. And then you want to just, I guess this is just not for me. I guess I can't do this. But if you bought maybe your vegetables you're going to use later in the week frozen and you don't get to them, well, cool. Like that can roll over to your next week and you can start over again. So I think that's a great place to start if you really can't, if you're really new to it and you don't want to focus just on fresh. I mean, there's so many levels of it. Like you can get to the farmer's market that obviously would be like a gold standard, or join a CSA, community supported agriculture, and have a box of fresh produce delivered to you. But if you're just getting started from eating out mostly and doing a lot of prepared frozen meals and you want to get to this whole foods lifestyle, like you can't go from one extreme to the next. You'll be overwhelmed, you'll burn out. And that's really what we want to prevent. I think that's probably one of the hardest things about this health journey. The journey of health is that we want to just like be there. But all these bad habits, we've been doing it for decades. So why do you think you can undo them in a month or two? Like this is the next 3 decades. Like it took 30 years to get here. Like let's spend the next 30 building these new habits and unraveling some of these old ones, because it's just gonna take time.
Yeah, for sure.
I think it's cool too how you talked about the trends of in different health. And like yesterday, I was reminded from a patient, remember the trend where we would add butter or coconut oil to our coffee?
Yes.
And like it's not the worst thing in the world, but it's so high. It can be so high in calorie. Of course, they don't necessarily need that.
Yes.
And we just get stuck on these ideas and think this is going to be the next thing. And I love your approach, how you're just more a balanced approach, like including all the macronutrients and all of these good things for you. And it doesn't have to be so extreme.
Yeah. I mean, do you enjoy eating out once a week with your spouse or doing happy hour with friends? Like, you don't have to cut those things out necessarily to get to health. Like, maybe you do need to do it when you're on your, 30 days of trying gluten and dairy and corn free. Like, I get that month is going to be completely different. Don't do that in November and December when we have all these holiday parties. You're going to be so sad and, might get 3 weeks into it. And then, it's Thanksgiving and you're the one that's asking everybody to cook differently for you. Don't do it now. Like, do probably start in January if that's what your plan is, but allow for those other things in life that you do enjoy. If you feel like it serves you well and if it has a good balance to it. Like, I gave up alcohol a year and a half ago now, and it's just like, I don't need to drink. It saves me a ton of money when we eat out. I found some alternative NA wines or NA beers that are also gluten-free that we enjoy from time to time, but it's just, I don't know. I don't really need it anymore, but I think it's okay if people do want to have an occasional glass of wine, but that nightly habit that's really getting people.
Totally. Tell me about how our listeners would identify if there is like a more toxic food, or how to identify non-toxic foods. What do they look for? Is it packaging? Is it certain words? Where do you recommend people grocery shop to get those types of things?
Yeah, good question. I think it's great to think, like, did this food exist now, like when your great grandmother was alive? Or is this an invented food? And then when you read the ingredient list, what do you recognize? Like, could you, if you really wanted to make this Nutri-Grain bar at home, could you buy all of these ingredients and make it at home? I think that's always a really good test. Like, is this company, utilizing mostly whole foods? Or again, is there like 5 different kinds of sugar? Is there artificial flavor in there? When you see artificial flavors, at least for me, I'm thinking there is like very little nutrition in here, or it's very watered down. Like, if you buy, since we're dairy free, we do buy dairy free milks from time to time, like almond milk or an oat milk or something like that for making smoothies. And when you compare all the brands that are out there, there's a lot of added flavors. And to me, I'm thinking this must be so watered down that you can't even taste the almonds in it, that they're adding almond flavoring to it. And it's not almond extract, or it's not real like vanilla extract. It's an artificial flavor. But there are brands out there that don't add flavors, and it's because they're actually using a lot of almonds to make the almond milk. And there's also more protein in those, or more healthy fats in them. So I think when you start comparing those ingredient lists and you realize, like, well, this company's probably really ripping me off. It's like watered down the version that I would make at home. If you can make it at home, great. It tastes amazing homemade. Really almond milk is so good homemade. But yes, there's going to be a price difference between the two, but like between the two brands, one might have 1 gram of protein per 8 ounces and the other one might have 4 to 5. That's a lot of extra nutrition and a lot of less additives and added to it. So I'm comparing products like that at the grocery store. Again, same thing with the approach of not trying to do too much at once and look at all the labels. Like, pick one new item when you go to the grocery store and compare them if you can. And then, you've found your almond milk that you can stick to, or you've found your granola bar that's your, go-to travel granola bar, your road trip granola bar. Like, maybe it's not something we need to consume every day. They're very expensive. We could find something maybe healthier to have for breakfast instead of a granola bar. But if you want it for traveling, and you can compare the ingredients and find one that's doesn't have a ton of added sugar. It's made with whole grains. It has real fruit in it, not just fruit flavor. That's where I would start.
Do you strongly encourage organic, or how do you navigate that conversation?
Good question. I think it can be tricky. I do recommend it as much as you possibly can afford, for sure. I think the tricky part with organic comes in when it comes to like meat and eggs and chicken and so on. I would prioritize something that is pasture raised over organic. And for that reason, because you can have organic, you can have organic yogurt from cows that are raised indoors. That doesn't necessarily mean that they are grass-fed cows. So that's the tricky thing. Same with like eggs. Like you can get organic eggs, but it doesn't mean that the chickens are actually outside. And I think you get more nutritional benefits from chickens that are outside laying eggs than a chicken that's indoors laying an egg that's just fed an organic diet. So that's what that means. I actually created a course, how to navigate the grocery store specifically for label reading for this reason a couple years ago. I haven't promoted it in a really long time, but I literally went through every section of the grocery store except for, the snack aisle basically, and talked about like, how would I choose between all of these different yogurts? How would I choose between all these different eggs? How would I choose between all these different, the chicken meat that's there, and what actually means something and what's just marketing. Just putting the word natural. I looked this up last year. There's like a natural foods expo, not the Nat Expo, the I don't know if you've heard about that one out in California, but there's a different one that's specifically for food producers. And they found that people will pay double, if not triple, just for the word natural on the product. And natural for most things in the grocery store means nothing. It means something for like chicken, but for a lot of other products, it means nothing. People can throw the word out regenerative grain or happy cows or something like that on products, and it means absolutely nothing, but they know that people will pay more for that label. And since you read it on the front of the package, you might not even flip it over and look at it and see that like what's natural about all of these ingredients. I flipped over a package of crackers the other day. I was at a convenience store waiting for something, and it on the front of the package it said like made with real vegetables, and I was like, okay. Flipped it over and looked at it. There was the only vegetable listing thing on here on the crackers was vegetable oil. There were no veggies in these crackers. It was an enriched wheat. There was I think maybe like rosemary, but I mean that's not a vegetable; it's an herb. So there was no vegetables in there. The package was super fancy, and I was like, oh, I hate this scammy marketing.
Yeah. How do you even like live with yourself? If you're the one putting that out there.
I know.
Like, oh yeah, I'm going to do whatever I can to trick and misguide my customer.
100%. Yes. Yeah. Fruit snacks do that. I mean, they're going definitely after parents that are grocery shop trying to, okay, if I'm about fruit snacks, I'm going to at least get the ones made with real fruit. But when you read the label, it's like fruit flavor. There's no fruit in it. So you really do have to take time to kind of compare some of those brands out there. You know, if you don't have someone to sit and ask like your favorite brands to, you have to kind of compare them a little bit.
For sure. Take the time to read it. I tell people, literally take an entire afternoon or 3 to 4 hours, just knock it out. Like, what are your basic things that you will eat every week? Go find the replacements and be done with it. Right. Like it's painful, but just go do it.
Yes.
That's why I just like to stick with the whole foods. It makes it so much easier.
It's going to save you so much money if you're not just out there looking for these better ultra processed versions of foods. Like I get we have to have convenience things from time to time. They have their place. But if you don't have to rely on them regularly, you're going to save so much money at the grocery store.
For sure.
So much money.
For sure.
All right. Last but not least, so I love macronutrients. I love teaching people how to build their plates, how to have all those macronutrients on there. But it can be really hard when they do a batched recipe. So do you have some tips and tricks of how to figure out your macros from a batched recipe?
You mean so the meal has been prepared?
Yes, how do like a casserole or something like
and
that.
how do they calculate it from that? Yeah, that is really tricky. I include the macro breakdown for every single one of my recipes. So again, if it's like a batch of chili or we had coconut curry meatballs the other night, and I'm trying to think what we had as a side with that. Maybe rice with it. But every single recipe, I think starting with a recipe that has the macro breakdown is going to be your best bet, right? So, the recipe has 4 servings and it tells you each serving has, 20 grams of carbohydrate, 35 grams of protein, 15 grams of fat. and do your best really to divide out that recipe, like once it's served. If you want, if you're only going to eat 2 servings of it right away, or just one of it, even portioning it out in the moment. So you have your meal prep containers out and dividing out your meatballs per each of them. Otherwise, yeah, it's near impossible because your recipe's all put together. So I think you just have to do your best with at least starting with a recipe that has everything already calculated for you, like making sure you are measuring your ingredients. Otherwise, you're not going to be able to measure it after the fact that, how much rice is in this scoop that I have here, how many carrots did I get in this scoop, and how much meat did I get. Just trying to at least start with a recipe that already has the macros there, and then adding those exact ingredients. Like, I'm someone where if the recipe calls for like 2 carrots, but my bag came with 5, like all 5 are going in, unless I have a plan of what I'm going to use those remaining carrots for. But yeah, otherwise, if you're really tracking macros, that's the best way to do it with a like a casserole type dish, something that's mixed together.
And then on the macro conversation, do you typically, for men or women, do you typically recommend 1 gram of protein per pound of ideal body weight? Is that like a good place to start for people?
I think that's good, but I actually have people calculate it on a percentage. So
Okay.
I teach people, I have a quick macros training inside the membership, and I have people calculate their daily goal for calories.
Okay.
So whether it's maintaining their weight, gaining weight, or losing weight, so they get their total calories, and then I have it break it down by percentage. Because sometimes when you calculate out a gram per kilogram or a gram per pound, some people go both ways. It ends up being like 40% of their daily calories or 15% of their daily calories. It doesn't always fall in the right percentage, and then they have to make up eating way more carbohydrates or less carbohydrates. So I like to start with the percentage of their daily calories, and then help them calculate how much protein they need, and then carbohydrates, and I do that on a range of like, are you someone who really feels drawn to carbohydrates and like wouldn't ever, like if you cut back on them, you feel really deprived. And then we usually do like the top end of the range. And if people can do lower carbohydrate, we go there. My menus are on the lower carbohydrate side, heavier on protein and fat. And then we finish it off by the last percentage of it being the fat calories. And then I have people start there and then see how they feel after doing like a week or 2, hitting that and focusing on 1 macro. So you may have calculated out all of them, but just start with 1. I really, for most women, because I work mostly with women, I'm like protein, because you're eating this 100 calorie yogurt cup for breakfast that has 6 grams of protein in it. You're not satisfied. You're eating almonds and crackers and grapes for lunch. You're not getting enough protein, and you're just hungry all the time. So let's focus on hitting that. What it ends up usually being is 25 to 30 grams, sometimes 35 grams of protein per meal, or maybe breakfast is a little bit less, so you don't have to eat 4 eggs. And lunch and dinner are a little bit heavier on the protein than breakfast, and see then how you feel. And what I see people doing on like social media is this like, I need 150 grams of protein, or I need 200. And it's like, do you? Or have like you actually calculated out what you need? Are you following what an influencer is doing? And then if 150 just feels like next to impossible, or you feel uncomfortable, or it doesn't actually feel, you don't actually enjoy a meal that is that meat protein heavy, then let's adjust it. So I think that's an important trial and error part of it, is find out what you need, try it for a week or 2 and see how you feel. Most people are under consuming. So if they can bump it up at all, they're just like, oh, wow, I don't have to eat lunch early anymore because I actually feel really satisfied all morning long. And I'm not starving when I get home at 4:00 in the afternoon. I could actually wait till dinner time. So I don't disagree with that number, but I like calculating it off of daily calories, because then people can also break up how many grams of carbohydrate that they need per meal, because people don't really know, like, is this a lot of carbs for me, or is this not that many carbohydrates for me?
And I think it's funny too, the discussion with carbohydrates, how different that can be for people. Like, I need about 200 grams a day, and I feel better with higher protein, high carb, more of a lower fat diet than others do. And it's just so how interesting it can vary for each person.
I agree.
Yeah. And like you talked about in our last podcast about energy expenditure,
Yeah.
like that's huge.
Have to
You know,
take
you
that into
have to
account.
look at what are your goals and then what is your energy expenditure around all of those things.
Yeah, I think
For
we've
sure.
we've taken this fear of disordered eating
Mhm.
and creating a restrictive eating pattern by teaching people how many calories they need to like the extreme where we're just like, people don't know
Yeah.
what they need. Like they
Mhm.
know how to use their iPhone and take care of their car better than they actually know what their own body needs for nutrients, which is really kind of silly. You're just like spending your whole life just guessing what we should be eating. So I think it's really powerful to calculate out what you need and actually get an idea of like, whoa, like when I eat pasta, I'm like eating double, if not triple, how much I should be having. Rice obviously is a really easy one to overdo, but like it can fit in a healthy meal plan. You know, I was in Vietnam last year and they live off of rice in every form and noodles, you know, the pho noodle bowls or rice. It and their desserts, it's all rice. And I did not see one obese person in the almost 3 weeks I was in Vietnam.
Wow.
It's one of the lowest obesity rates in the world. And they live off of rice. I mean, we fear rice in this country like no other. But it's obviously we overconsume it. We're very sedentary, and we don't pair it with protein and fiber and healthy fats. So,
and I think it's also even just like fearing calories, the whole calorie counting thing. There is this subgroup of people who are fear mongering certain macros where really having a balance of all three is so important and not fearing a certain one.
Yeah, I think it keeps people really paralyzed. It's like if I'm gonna have to cut out all my favorite foods, then I'm probably just not gonna make any effort moving forward at all. And it's like, oh, there's so much opportunity missed there. Even a gluten-free diet. Like when I first, my MD recommended, actually, she recommended it to me as one of the last ditch efforts for my endo pain. And I was like, ooh, what else haven't we tried yet? I was like, I don't want to do that. And, you know, I think I was doing sourdough at the time too. So I was like, no, like I'm having so much fun. And so I was like, okay, I got to try it. Like I was recommending it to patients in the whole, you know, basically the whole 30 AIP. It's like, I got to try it. And like 10 days in, I had chronic knee pain from a knee injury I had in high school since like 7th or 8th grade. And in 10 days, my knee pain was completely gone. It was like, oh, that's so weird. I haven't felt my knee pain from running for the first time. And it's never come back staying gluten-free. I mean, it was not the thing that was on my forefront. I was thinking more of digestive symptoms that I would notice or skin or something. And it was like, whoa, that's absolutely incredible. So I think teaching people again that making that just like little step forward is so important, and guiding them is, you know, key. You don't have to go gluten-free alone. You can get, you know, work with a practitioner to help guide you, get a bunch of recipes before you start, so you're supported and ready to go and understand what you're looking for at the grocery store or at a restaurant. If you happen to have to eat out during this time period, don't do it during the holidays. And then, you know, see what your transformation is. You don't have to go in alone.
Can you tell me what your opinion is on eggs?
Just eating eggs in general?
So many people are like, my doctor told me I can't eat eggs.
Cholesterol.
Oh, man, that will never die.
Yeah.
So that was ditched. I think that was ditched in 2015. The 2015 dietary guidelines got rid of cholesterol foods causing high cholesterol. So why
do we not hear this?
Mind blowing.
Where's the lag here?
I know it's so amazing how long it takes for that to go away. There's still a little fear mongering around like saturated fat with it, but I think that's going to be the next thing to go, because in 2020 dietary guidelines, we got rid of total fat restrictions. So there's no recommendation for a low fat diet. The only thing that's recommended to limit now in the dietary guidelines, which I don't know why we're really following them, because they're really, I mean, the study that came out, I don't know if you ever saw that in 2021, there were 700 different conflicts of interest with the committee that put together the dietary guidelines and what industries they all worked for, whether it was the dairy industry, pork industry, whole grain people. I mean, you could just see where the guidelines overlapped with all the people who worked for those food companies. You're like, what are we doing here? How can we trust any of these guidelines when, Cheerios is one of the only things that has a heart healthy label on it.
Does it still?
Yes.
I don't ever look at it because I don't ever buy Cheerios, but
yeah, and Kraft mac and cheese actually was the only product that my organization, the Academy of Nutrition and Dietetics, endorsed.
Wow.
Because they made the noodles like whole grain and the powdered dust counted as like a serving of dairy. But the dietitians, like us as a group, were like, what are you doing? That they repealed it and they didn't do it. So there's so much industry influence when it comes to food that's why it's like, what did your great grandma eat? What does your gut say? Like, what does common sense say that you probably should be eating or not eating?
Yeah.
Right.
I literally had a patient yesterday who has high cholesterol, runs in her family. So she was working with a dietitian and she couldn't figure out why she wasn't losing weight. So she's working with this dietitian to help her with a heart healthy diet. So this dietitian has her not eating meat and has her getting her protein from legumes, black beans, etc. She can't figure out why she's gaining weight, can't put on muscle. And it's like everyone's hands are in this. And I just told her frankly, I was like, that's not the way to go.
No. And especially if you enjoy meat. Too,
yeah.
Right.
And if you're gaining weight by eating that way.
Yes. That's one thing that macronutrient counting will really open your eyes to of, if you're going to replace all of your meat products with beans, most of them have more carbs in them than they have protein. And so people don't realize that they're doubling, tripling, quadrupling the amount of carbohydrates and then also serving them over rice or with bread. And their carbs are going way through the roof, but they are replacing their red meat consumption. I would rather see people look for quality. And I mean, some people do overconsume meat. So it's not a bad thing to look at how much are you actually consuming? Are you doing a variety? How much fish are you consuming? Minnesotans are really great at eating, salmon and those things. So yeah, get some of those omega-3s in to your diet and think about where you're getting all of your meat from. Also, when we talked about toxins earlier, you can create toxins when you cook food. So meat cooked at high temperatures, you create amines that act like free radicals in the body, which are very similar to smoking a cigarette. So burning your meat, like charring it, everyone loves to eat the char when they grill meat, is really toxic to the body. And the body has to work really hard to clear that out. So really thinking about cooking your meats low temperatures and slowly. Like if you're going to cook bacon, don't cook it on high heat where the grease is splattering everywhere. Everything we want to try to cook at low, slow temperatures with acid, especially is another good way to cook meats. Like so in like chili, for example, cooking red meat in a tomato sauce is a great way to reduce some of the negative effects of consuming meat. So that is one way where I would say, if you have a client that is consuming a lot of grilled meats, they're big grillers, I think they really need to consider not, cooking things really, really fast at high heat and not letting them char.
I did not know that.
Yeah. Hydrocarbon. I'm mixing up the word. There's an acronym in there of what's created from that. Wow. And it's a toxin in the body. Yeah.
That's very unfortunate because my children really like crispy bacon.
Yeah. Oh. It's better to put it in the oven, right?
That's what I do, but I still bake it till crispy.
Well, bake it slow. Just don't bake it at on the highest.
Not the 425.
The highest temperature.
The broil.
Exactly. Yes. And eggs, I'm all for eggs. What a great breakfast. I mean, they pair well with vegetables and
yeah. It's right. It's our nature's multivitamin,
yes.
Right? It's pretty much everything.
Yeah. Yeah. I don't know. When it comes to cholesterol, obviously cholesterol is a sign there's inflammation in the body. Yeah. So we got to put out this fire. What's it coming from? Is it coming from not moving your body? Is it coming from tons of added sugar? Is it coming from stress? I mean, on my cardiac floor, I remember interviewing people and I'm like, what do you eat? And they eat actually pretty well, but they have this high stress executive job where they just don't sleep well. They're constantly stressed. They eat well, but they're eating in a stressed out state and they're moving from one thing to the next. You can't discount the toxin of stress on the body and on the heart. I mean, but then we quickly blame food. And then we have people switch from eggs for breakfast to like Cheerios, right?
Healthy
that
Cheerios.
would be the swap that they would recommend, is to get in that fiber through Cheerios or like Raisin Bran or something. And there's no real nutrients there. It's so heavily processed. So I'm all for the eggs. And taking a closer look at cholesterol. I don't know. Do you guys test for like LDL, like particle size? I think that's something that
like lipo, all the different cardiac markers.
I think that's a really important thing that not a lot of people are getting that information in their doctor's office of like, we can take a closer look at what do the particles actually look like. And are they actually bad?
Yeah. We'll see. Hopefully some of the medical training in general will start to shift a little bit.
Yeah.
It's time.
Yes.
For sure.
Yes. The old lid out there.
Okay. So wrapping up, please tell our listeners how do they find you? Do you have an Instagram where they can follow you? Anything else for them to kind of see your information and maybe learn a little bit more?
Awesome. Yes. So Instagram's my main social connection. So Anywhere Nutrition, just one word, is where you find me on Instagram. If you find me from this podcast, send me a message. I'd love to know that you listened to it. And I have a website, so anywherenutrition.com. So that's where you find information about signing up for the meal plan membership. You can sign up month to month, so you can come and try a month or two and see if you like the recipes that I pick out for you, if it fits your flow of what your family needs, and if it's not for you, you can cancel it anytime, just like Netflix. I have a recipe index you can search through. So it's one of my favorite things about it and about creating an app is, if you have salmon at home and there's not salmon on the menu that week, you can search salmon. It brings up every salmon recipe, and it's all macronutrient balanced. It's based on the seasons. You don't even really have to be gluten-free to benefit from it. I have a lot of people who aren't gluten-free that are in the membership because I write things out as, look for a whole grain tortilla. Are you going to look for one that's a whole grain wheat? Or are you going to look for something that's a whole grain corn or brown rice or something? So it really works across the board for most people.
Cool.
The common thread between the gluten-free, not gluten-free would be it's anti-inflammatory and it's seasonal based. So right now we're in our 10th week of the fall menus, even though it feels very much so like winter outside. We're diving into fall produce and squash and potatoes and parsnips and all those lovely root vegetables and soups and stews. It's probably my favorite time of the year to dive into the menus. So you can find information on my website about joining the membership. And if you have any questions, you can message me on Instagram. You can email me, but I am a terrible emailer. It is maybe that should be my New Year's resolution. But yeah, so contact me there, and I would love to help you. I'd love to help make that what's for dinner question an issue of the past, and try to simplify healthy eating for you and your family.
That's amazing. I think pretty much everyone could use that.
Yeah.
I mean, I hear it every day with my patients.
Yeah.
Thank you so much for being here, Patrice. Thanks for joining us and for introducing us to Emily.
Yeah, that was awesome.
It was, I learned a lot.
I did
That
too.
was super helpful.
This was great.
Because we don't ever get any actual nutrition training in medical school.
I know. Part of me feels like I didn't get it in dietetic school either. I had to learn it afterwards.
I think I was in the same dietetics 101 with you.
Yes.
And then
Yes.
that was it.
She still used a projector screen in that class, with the slides.
Yeah.
Oh my gosh. So outdated.
Yes.
That's awesome.
Yeah.
It's crazy. Our kids wouldn't even know what that is. Like the tape recorder and none of that. So
the future is going to be wild.
Yeah, for sure. All right, ladies, and all of our audience, thanks for listening today, and join us next month. I don't actually know what we're talking about next month, so stay tuned.
Thanks for listening in to the Flourishing Life podcast. You can watch this full video version of this podcast inside the Spotify app or on our YouTube channel. If you like this episode, please rate, review, and subscribe on your favorite podcast app, and be sure to share this episode with a friend, and follow us on socials at Flourish Medical Wellness and on our website at flourishmedicalwellness.com. The information on this podcast is for educational purposes only and is not intended to replace medical advice or to be a substitute for professional medical diagnosis or treatment.